Oklahoma lawyers now suing to try to force CDC safety guidelines to apply to Donald Trump's indoor rally planned for this Saturday. And this is a real controversy. It's gone all the way to the state's Supreme Court today. They argue it's now the only institution that can stand between Tulsa and a, quote, biological bomb. The court held a telephone conference with these lawyers today. The decision could come as soon as tomorrow. And the arena is now asking, this is interesting, the Trump campaign for written health and safety procedures. Trump, meanwhile, downplaying the virus. Take a look.
Coronavirus cases are rising in 22 states, including Oklahoma, where you plan to hold a big rally this week. Aren't you worried about people getting sick?
No, because if you look, the numbers are very minuscule compared to what it was. It's dying out.
It's not dying out. And as for the specific thing the president is doing, going to Oklahoma, let's take a look at the new reported cases by day there, considered a public service for people planning their decisions in Oklahoma. You see on the right the new cases. Meanwhile, if you go abroad now to other places that Trump may not be visiting, as mentioned, 20 states are seeing a spike, some hitting records. A model that has previously been cited by the White House as an authority is now projecting 200,000 American lives lost to the virus by the fall. One task force member, Dr. Fauci, discussing this and how Trump and Pence have been downplaying and misleading on what's actually happening. That's the context for him saying, of course, Fauci would not attend an indoor packed rally. Consider it a discussion of whether you want to follow doctors' orders. Joining us now, one of the lawyers actually suing in this case, attorney Clark Brewster and Dr. Samantha Whiteside, an emergency physician who recently wrote about how this is an issue. Quote, I'm a Tulsa emergency physician and a conservative, and the Trump rally is a terrible idea. Both of you newsworthy guests, but given the health issues, I start with you, doctor. Explain why you wrote that.
A little bit. No, I think we're in a small Midwest city. Anytime a sitting president wants to visit is an honor, but this is just not the right time. Our cases are up more than 100% over the past week. New cases are about quadruple today what they were during the height of social distancing. While we all have quarantine fatigue, unfortunately, the virus does not discriminate. And I think it's a real risk to our community and people who come from other communities and then travel back to their areas where maybe it's under better control right now.
Yeah. And you're giving us a medical view, but you did self-identify as a conservative. I think we all know that aspects of this have taken on a political tint, whether that's good or not. So with whatever respect to however much you want to share about your own views in politics, it sounds like you are sympathetic or in agreement to many conservative beliefs and thus people who follow the president. And so given that, I want to give you the chance here to use this platform to speak on that. Here's a little bit of our reporting from basically rally goers in Tulsa today. MAGA supporters talking about all this. Take a look.
What about the coronavirus? So we're at an all-time high for cases here in Oklahoma. Are you worried about it at all?
I'm not worried about the coronavirus any more than I am a regular flu. You know, I could catch the regular flu in a year. I could catch this as well. So I don't think it's any worse.
Doctor, what would you say to her?
So, you know, I wish that were true and that it were similar to the flu. But what we know about this virus is that there's very little immunity for anyone currently for this novel coronavirus. There's no effective treatment. There is no vaccine. There's nothing that we know that works. It is more contagious and more deadly than the flu by an exponential factor. And the best treatment that we have right now is to prevent it to begin with.
Clearly put. Clark, are you okay with me opening with a lawyer joke with you, sir?
I guess so. Go ahead.
I'd just say we usually need doctors more than lawyers right now, speaking as a lawyer myself. But
well, I would disagree. I would disagree on this issue. I think we need lawyers right now to stand up
there you go.
To get an injunction.
That's where I was going. From a lawyer joke to a compliment, you are using your role and trying to go to court because basically what you're doing is using litigation to back what the doctors are saying. So we may actually need a lawyer, call a lawyer and a doctor here. So walk us through why this is important in your view, why you think, as I understand it, you're arguing this court has an obligation to help protect people.
Yeah, certainly the first effort was to reason with the management to delay this rally. It's great that the president's coming to Oklahoma and his supporters can get behind him and show their love for him, and we'd be happy to have him here in Oklahoma. It's not a political issue. But at this time, as Dr. Whiteside so carefully put in today's article in the Tulsa World, and just as she spoke, it's going to be a powder keg of super spreading this virus throughout our community and in other areas in Arkansas and Texas as these people gather. And there's no way to comply with the CDC guidelines. They can't even begin to try to comply with that. As a matter of fact, what's really fascinating, it came out today in meetings prior to the argument for the Supreme Court, or the Oklahoma Supreme Court today, is that most of the workers that work at the BOK Center have now said they don't want to be at the event and are opting out of service. And so the workers are going to be 300 Trump campaign volunteers that aren't familiar with the venue, wouldn't know a disaster plan, exits. I mean, it really is a colossal nightmare. So we're very pleased. We filed this action asking the go ahead.
Well, let me ask you whether the president hurt himself in your view. I did want to get this news in here for folks because he's responding, but he might be giving you evidence. He says to the Wall Street Journal, quote, some attendees might catch the virus, but it's a very small percentage. Clark?
Well, I don't know what he means by a very small percentage. If you get the virus by virtue of the spread from attending this event, it's 100%, okay? I mean, if you die, it's 100% rate of death. We have a situation here where they're so concerned about spreading it that they're asking the attendees to sign releases. And his fervent supporters may do so, and that may be an accountability issue for them. But when they leave that venue and go back to work at the nursing home or at a daycare center or in our community, as Dr. Whiteside points out, we're at great risk to spread this. What is a certainty is the medical consensus is this is going to spread the virus and this is going to cause death. And our position is it's either delay the event or cause the illnesses and death. And I think delaying is much better than causing death and illness.
Really striking. You're both directly involved and sharing your expertise, and we appreciate it. Clark Brewster, Dr. Whiteside, thank you both. And Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.